think of it as this. Minimally invasive surgery is just another great alternative foot and ankle procedure we can provide patients.
Because many people have you trained now, Dr. TJ, in the minimal invasive. I mean, it must be in the hundreds, if not coming up on thousands. How many would you say over the last number of years?
Oh, I've hosted and organized international MIS cadaver lab conference past 3 years. All of them sold out. That's close to 200 doctors. I did that, every year. And then my private clients, I trained over 60 doctors now in our private course and private cadaver lab.
This is the Justin Blake podcast experience for health professionals that mean business. So wherever you are in the world, listen as we discuss everything you need for you and your health business to survive and thrive. Thanks for listening.
Good afternoon, everybody. And here we are again on a lovely Tuesday afternoon in Carlingford in Ireland. It's 3 o'clock in the afternoon. And I'm with Dr. TJ Ann in Chicago, Illinois. Hi, TJ. How are
Justin.
You?
Hey, pretty good. How's Ireland treating you right now?
Well, it's a bit rainy today, so there's no tennis this morning, unfortunately. Hopefully it'll pick up this afternoon. Too many puddles on the court.
Wow. So, I've never been there. I've never been there yet.
Oh, you got to come. That's why it's so green.
Oh, is it? Yeah.
So, morning time for you there, but I'm sure you're like me, probably up quite early anyway, most days.
Yeah, it's 9 o'clock here. What's the time there?
3 p.m.
Okay.
3 p.m. in the afternoon. Yeah, so I've had a busy day already with a couple of colleagues and things, and so how's summer in Chicago been? Of course, it's been quite strange times recently.
Yeah, I mean, I have never seen this before in my whole life, obviously, and then I've been talking to my counsel, my mentors, who are older and more, obviously more experienced and more wise. I do keep in touch with my mentors, but then they all said, every single of them said they never seen something like this before in their whole life. So it's something unique, something different, But again, I'm always saying, it's like you cannot let those media or, whatever politics get into you. You can be aware of it, but you cannot let anybody or anything negatively influence your focus or decision making, So
yes, interesting times in the world, TJ. Very interesting times.
Okay.
Yeah, it's certainly been interesting times. I mean, I found the first 3 or 4 months of lockdown were fantastic. Really good time to a lot of reflection. A lot of time to spend with friends and family, friends on Zoom calls. I would be talking to friends weekly now or bi-weekly, where I would have maybe spoken to them maybe once every 6 months before, or maybe seen them when they were home from holidays. My friend Charlie in Australia, we have a regular Friday call with him now, and I would usually speak to Charlie maybe just once a year when he's back, and maybe one or two other times during the year. So I find it really good, and it's been a good time to just to sort of refocus. I mean, how have you found? I mean, I know that practices are here because, of course, the situation is continually changing. With sort of rolling lockdowns and things. I mean, Spain and France and things has changed. I mean, are there practices there who are still not? I was talking to one of your colleagues in, I believe, in Texas last week, and they're not back doing any elective surgeries as yet. Yeah,
I mean, Chicago, the podiatry practice still has been considered as essential, and if you practice, sterile procedures and rules and guidelines, I mean, that shouldn't stop doctors to do elective procedures,
Oh, well, all their elective procedures stopped in March, and they're not back doing any electives yet. I presume that they're working within an HMO or a service. They're not just mainly in private practice, but they're still not back to do their elective list. They have, like colleagues here, continued to do emergencies, especially the diabetic foot care and things, but no, in Texas, I just can't remember her name off the top of my head, but last week she still hadn't restarted any elective lists.
I see. Yeah, that's, well, I don't know about that because I have clients, I've been helping other doctors as a consultant, and I have a few doctors actually practicing in Texas, and they're doing procedures. So I don't know. A lot of times, I want to talk to you a lot of times, not just the podiatrist, but, the business owners sometimes you have to look into yourself. What are you driving? What's driving you? Is that out of fear? If you operate your business out of fear, away from bad things, sometimes I think that will influence your decision making and your operation, especially in uncertain times, in tough times. So, I think it's just the way you might look things.
It's a mindset. Mindset. If you're looking at things from a position of abundance and everything, you have a completely different mindset. If you're worried and anxious and as you say, watching a lot of media and listening to all the noise that's going on. We've been talking about this on our business calls for 3 months. Abundance is where you want to come from, not from scarcity. The scarcity mentality is a very, very bad place to be.
Oh, especially now. Yeah, scarcity, that makes this whole thing, even small things, look so big and so, scary. But, we do deal with fear. I do have fear, but everybody has, different degrees of fear. But especially these times, if you operate your business and practice out of fear, I think it's very serious. And I talk to my colleagues every day. So I am constantly trying to help them. Okay, where you're coming from, that decision making shouldn't be from fear. It's from numbers. You work the numbers. I'm not telling you to make a decision just out of emotion either. Just you look at the number, and then if this number works, go for it. And if it's a calculated risk, for like investing into new movement or things like that, obviously you have to be more careful nowadays because we all have a little bit lacking cash flow for a lot of doctors. So you do have to look carefully, but look at the numbers, not out of fear. That's what I'm trying to say.
Yeah. Because a lot of practices, especially here, the way that a lot of practices don't really run as a business. They always have very, very little buffer in their practice for for eventualities that come up. The sterilizer breaks down, or somebody goes on maternity leave, or there's all these issues. And a lot of practices are just running sort of what I would call hand to mouth, and it is. That's not the way to run a business. I think if you've listened to any of my calls before, I used to run businesses very badly for a number of years. And until I realized that I had to start investing in learning how to run a business properly rather than just, instead of being a busy fool and thinking you were doing well. Where have you gone, sir? So Dr. T is now gone. You're off on Instagram. Is your phone dropped off or?
Yeah, because the angle is not correct. Instagram only does it vertical. So I just sent requested again.
Okay, cool. Yep. We'll just go live with Dr. T again. For eventualities that come up, Let me just see. The sterilizer breaks down, or somebody goes on maternity. Right, that's that again. We're live again. Great. So yeah, they practices sometimes. A lot of them didn't have a buffer. Some colleagues did and used this as a time. I know a couple of colleagues used the time to revamp their clinics and restructure, and it really made use of the close down time. Got the workmen in and rejigged their whole clinics. They were good practices which had, ran properly and were able to reinvest in themselves. And of course, a lot of the talking I've done over the number of weeks is, again, how we need in fees and practices need to be justified. Well, they don't need to be justified because you have to have a good fee structure to be able to invest in yourself, to be able to invest in your family and your practice. That allows you, of course, to then better serve your patients.
Yeah.
Yes. Yeah. And so, again, if practices are coming from the scarcity mentality, especially now where on one of my mastermind business calls that we have every Wednesday, people are worried about now with the financial situation of their patients. And as one colleague told me about 25 years ago, as soon as you start to worry about your patients, well, as soon as you become your patient's bank manager, it's not a very good way to run your business. So they have taken, some colleagues were advised to increase, the guys that I coach and mentor, a lot of them have taken this as an opportunity to actually increase their fees. Because, of course, with the way that the social distancing works and practices, you're going to see, well, of course, there's going to be less patients coming. You're going to have extra time with the patients. And then you're going to have all the extra costs of PPE and things.
We do all respect this. Instagram doesn't make me focus this conversation, because I have to keep looking at it and just keep echoing it. So I'm going to turn off my Instagram.
Well, please don't, because if you just turn down the volume so we don't get the feedback and then just ignore it, it'll be fine.
Yeah, but problem is I'm hearing all these echoes from your speaker. It's like I can hear your conversation lagging, and then when you're talking now, I can hear both conversation. It's very hard for me to hear you what you're saying.
Okay, let's get rid of Instagram. Sorry, Instagram. Dr. T's going to go on Instagram, but we're going to be live on Facebook and YouTube. So you can catch us for there. Talk soon. Okay. So
sorry about that, but now I can hear much better, so I can focus on our conversation.
Cool. Great. So where were we? Yeah. So back to some colleagues took this as an opportunity again to increase fees, not to reduce or worry about about what their patients could or could not afford.
So I totally agree 100%. Yeah. As soon as I start converting my practice to hybrid concierge, which you don't depend on a fee structure by government or insurance plans, you can start providing better value package to your patients. And, patients love them because they get treated differently as a concierge patient. And then you can raise your prices, but they see so much more benefit as a package that patients don't see that as expensive. And, I started doing this since 2016. And when I help other doctors, that's the first thing. However, like you said, doctors you talk to, they're worried about what patients finance. Actually, what you're doing is you're mirroring your own fear of pricing, that you don't accept that pricing is worth it to you. So you're concerned, and that emotion, energy from you, it already mirroring to your patient, vice versa, that it's not going to work out. I've done and helped many doctors. You have to first understand that fee structure is so fair, or even you are over delivering compared to that fee structure you want to raise, that kind of mindset shouldn't even come up, that you are providing this value to your patients to help them out of their foot problems, ankle problems. And your first concern is if they can afford it or their finance. you cannot influence their decision. You cannot go into ethical persuasion, So, I think I think that's psychology. Huh?
It's very much a mindset. I mean, I don't know whether you're familiar. I had my hip replaced last October. I certainly wasn't finding the cheapest orthopedic surgeon, and I certainly wasn't going to ask him whether he could do me a discount.
Exactly.
Definitely not. I wanted the best guy, and I wanted the best job done, the best outcome, and it's been absolutely fantastic. And,
right. I think that's why it has to be coming from ethical stand that deep down you are ethically providing the best value available. But again, to be ethically influencing someone, you have to be really good at it. What you provide.
Yep.
I can provide this. I can fix this problem. That confidence has to be in there first. Then, okay, well, you come to the best, and this is what it takes to exchange service. And, the value they're going to get from you and your service, it has to make sense to you first. Like you said, it's a mindset. Yep. A lot of times it comes down to mindset. However, I'm sure, Justin, you agree. When I talk about mindset, a lot of doctors, typically they're logical, analytical, and more scientific mindset, scientific evidence-based. So whenever I talk about mindset first, and usually not many doctors can accept that. They're like, oh, it's another woo-woo stuff. No, I don't believe in that. However, believe it or not, that's the core stuff that you need to break through.
Yes. And I mean, that was the title of my talk now. I think ethically we need to charge higher prices, again, to reinvest in ourselves, our family, and our business to better serve the patients. And that was one of our Sunday evening talks on the Ireland Podiatry site. This is probably about 12 weeks ago. I got myself in trouble on that talk because afterwards in the question answered, they said, well, how much would you put up your fees? And I said, double them. They were like, you can't do that. And it's like, but as you just said, it's not just mad guy on saying double your fees. You have to give patients the better service, the better quality, the better value if you're going to charge higher fees.
Yeah.
Yes.
Yeah. So if they don't believe, because I practice what I preach. So if they don't believe, I just show them my receipt. I have a printed receipt of patient.
Could you just repeat that again, because it just broke up slightly?
Yeah, if you say double the fee, and if doctors don't believe it, I just show them my receipt that patients have paid. It's not because I'm much better than the other doctors, but I just wanted to show them evidence instead of tell them. I show them, because a lot of times we can talk, but hey, where's the evidence? Show me the result. Then I show them the receipt. The patient really paid for my bunion procedure, really paid for my hammer to procedure. It's $2,000, $5,000 for bunion. They have to see actual printed receipt. Wow, TJ, that's really true. Yes, it's really true. But you have to structure the offer, structure the package. A lot of things, of course, come with it. But core concept, I say just double it, and they don't. They work out of fear. Those kind of, I'm not good enough.
I worked at a practice in London. I worked at a practice in London, and for the boss one Monday morning and said, we're doubling the fees. Guess what percentage of patients that we lost? I think it was 16% of patients were lost. That was it. Should have trebled them, perhaps. And again, this is the query. This is the query as well in the talk that I gave, was that if somebody's doing a ring around, how much is a bunion surgery? How much is a bunion surgery? And you're $1,500 and somebody else is $1,600 and the other practice is $2,000, but you're $5,000. Then in the patient's mind, there's of course the there's no differentiation between the other practices apart from the price.
No.
But if you're charging $5,000, like 2 or 3 times as much, well, then the patients, they're going to think that there's something different. What's better about Dr. TJ? What's better about Dr. Justin? What makes them be able to charge higher fees? And we got a lot more patients when we were running our practices like that, because people, again, don't want to charge. They want, especially now, of course, because people are so much more concerned about their health. The media tells us we have to get out and exercise more. I'm sure in Chicago it's like here. Everybody's out running, cycling, getting fitter and healthier. This is how we're going to prevent things later on. So people do not want to skimp on their health. They want to pay top prices.
Yeah, actually what I'm finding interesting, I started concierge practice since 2016. So my patient number, revenue, profits hasn't changed before COVID, during the COVID, after the COVID. I mean, I'm actually amazed at myself. This model works COVID-proof and bulletproof because this whole idea was not based on fee structure. You know, you create your own structure based on the value you provide, so that if someone's struggling right now, I hope you listen to this conversation, because there's a power and benefit of high ticket pricing structure.
Yeah.
It not only help you, skyrocket your profit, but actually what I find on myself and my clients I've been helping, patients get better results because the patients paid more. So they actually listen to your advice, post-operative instructions, everything. They follow word by word, and much less chance of going to complication.
Yes, yeah, and again, the person who's in price shopping you and wants the cheaper, they don't turn up on time. They don't follow the instructions. They complain, they bitch, and they moan, and you don't want that type of patient. I got myself in trouble because I used some foul language. There was a situation, but I was that person who wants it in a clinic and you get it $10 cheaper down the road. Off you go, mate. See ya. I don't want you in my practice. I don't want you, because that's the guy who's going to cause all the problems. Yeah, that's the guy.
By the way, here's a Dr. Tim Shea. He's one of my clients. He actually gave us a nice comment. Thank you, Tim.
Thank you, Tim. Tim, we're showing good discussion. I don't know how to get rid of this, though, now. After I click, but it doesn't matter. Good discussion. Anyway, and so those patients are price shopping, especially now, because people do want better value. But again, there's also the mindset is that, people are going, my area is different. The whole is like, I live here and I can't charge this. And it's like rubbish. I had my car service last week. It's a Toyota. I guarantee where I had my car service, it's the same price in Chicago. It's the same price in Illinois, in New York. It's the same price in Timbuktu. There's no difference. The iPhone 11, it's the same price in Dublin. It's the same price in Chicago. It's the same price in Outer Mongolia. They aren't worrying about pricing or where people are living and demographics.
No, many podiatrists I helped in United States. Can you hear me?
Yeah.
Yeah, many podiatrists I helped in United States, they're not practicing in the big cities. So at the beginning, of course, they had their own reservation. They're not going to be able to afford what big city charges. I said, well, again, mindset first, and then they actually, some of them charging more than I charge, So the location or size of the city really, if you think about it that way, okay, well, let's sit down and then talk about their living expense. It's much cheaper than big city. So actually, surprisingly, patients can afford more than what big city, residents can, So, I mean, it doesn't matter. It's a location free, Right.
It's location free. I'm talking with a colleague later on in southwest of England, and she's convinced that her area can't afford the higher fees that somebody 40 or 50 miles away is charging. She won't listen. Okay, here we go. We've got Gareth Woods on. Gareth is a friend of my friend Connor. Is a Chicago beat cop. He says, where you live in is near Oak Forest. He used to work in Austin, which is literally next door. He said it's one of the most violent areas in Chicago, in Austin. You know Austin? I'm sure you do.
Yeah, Texas, right?
No, sorry, Austin. I used to work next door. You know, is there not an area in Oak Forest or Riverside where you are called Austin?
In Chicago area?
Yeah.
Okay, so you're not talking about the city of Austin.
No, sorry, I'm talking Chicago. Sorry. So Gareth Woods is a South Chicago beat cop. He's from here in Carlingford in Ireland. He's lived in the States for a long time. Actually, a very fantastic musician. So he said you're next to Oak Forest. He said he used to work in the Austin area of Chicago.
Yeah, I got it.
Next door, and it was one of the most violent areas. So keep safe, Gareth. Thanks for your service. And those guys certainly earn their money. South Central Chicago. Yeah, it'd be interesting to go on a tour with Gareth the next time I'm over. Be quite an eye opener. You know, so yeah. So anyway, Gareth is and then I was talking to a colleague who's just started on her podiatry career, Cassidy Cutshall. She's just started at the Rosalind Franklin University, which I think you said is where the Shaw School of Podiatry has just relocated or amalgamated or just moved recently?
Not recently, like 2003. I graduated from Shaw in 2001, and they basically moved and merged with Rosalind Franklin. I've been teaching there at Shaw since 2017, past 3 years, for third-year students at the cadaver lab. Sorry?
I'm sure you'll meet Cassidy soon. Yeah. Then? Yeah, she was a cheerleader. I think for some the Texans and somewhere down in Florida as well. She's having a complete career change. She's going to be a podiatrist, so that'll be interesting. She's quite. She's looking forward to it. And I saw on an Instagram stream last night. There was one of the podiatrist guys, and I mean, I think some of the podiatry colleges in the States have started back as early as the first week in August. I think Cassidy's just starting now. So I mean, obviously they're a little bit. They are different things at a time. I don't know. Whether they're. I know a lot of the courses now, of course, are going to be done online. A lot of the courses. So you know, the practical element is going to be quite tricky. Are you aware of what's happening? Are you starting to lecture face to face, or are you starting to?
No, this year they cancel. This year so far until they announce, let us know. The clinical and cadaver lab instructors this year so far, it's been, we don't know how it's gonna go. We should have been already started, because past 3 years, typically my role in the cadaver lab starts in June and we finish in December. So
really.
Mm-hmm. So I don't know. I don't know if they're gonna have a cadaver lab, the capstone of cadaver labs or not. So. And
do they start the cadaver in the first year, or which year do they have the cadaver?
Yeah. So what we work more for surgery. It's not anatomy cadaver lab. So I teach third-year students who start doing more surgical procedures.
Yes. Okay. And do they get a cadaver in the first year or two?
Yeah. Gross anatomy in the first year in the United States, right?
Yeah, we had a leg or a lower leg. In our first year for gross anatomy. Hadn't any idea what anything was. I mean, not what we did when we dissected it, but it wasn't until about 8 years ago that I actually went back for another cadaver course, and now I mean it's so much. Well, so much more intrigued. I mean, the structures in the foot, especially because I used to focus on a lot of my practice in the last few years was foot mobilization and manual hands-on therapy. And you used to think you were moving things and stretching things. You're not moving shit. It's so tightly bound. There's so much structures. I think it's an input. I think it's all central nervous. It's CNS input, some type of stimulus we're putting in, whether you're using acupuncture or manual therapy or an orthotic or whatever we're doing. It's but certainly I don't think we're moving very much. I mean, everything, as you know, everything's so tightly bound. All the fascial layers, all the joint capsules. Maitland and Mulligan, grade 4, you probably need to get a jackhammer in there to actually get stuff moving. It's that tightly bound together. So, fascinating. Anybody who hasn't been on a cadaver course, in about 5 or 10 years, certainly recommended to do one again. It's fascinating. But so in our leg in their first year of our university at the London Foot Hospital, we did the gross anatomy, but we really didn't have any idea how things worked. So it certainly changed. So the students are going into, because of course, yes, in America, it's certainly a lot more surgery focused rather than here in the UK and Ireland. The podiatric surgery aspect is a postgraduate rather than the main 3 or 4 year primary degree.
I see.
And of course, I mean, you do an undergraduate. I mean, it's a medical speciality in the States. You're all qualified as doctors, where it isn't here. It's an allied health profession. Podiatry is rather than it's a branch of mainstream medicine. So you teach on the cadaver course the surgery, and of course you specialize in training podiatrists in minimally invasive surgery.
Yes. Yeah, I see so much more benefit. I've been trained as a traditional open surgery first, but yes. I was fortunate enough to meet masters, the true master of MIS, minimally invasive surgery, one of the pioneers. And then that kind of changed my whole perspective. It's Dr. Stephen Isham.
Okay. And what do you think of the benefits of the minimally invasive over open?
Well, first of all, I want to say there are places for traditional open surgery still effective and still needed. However, if I can choose, I choose minimally invasive surgery because obviously we create portal. Incision concept is not like a concept of slicing, creating line with the scalpel. The minimally invasive surgery incisions are more step, little poking, but you choose the known portal, create direct portal to the bone. Usually when we work bone surgery, so you go to the bone directly and then you start inside out, start deflecting capsules and ligaments all away from the bone. So you are not dissecting most soft tissue. You're just kind of starting dissecting it, but not cutting through the soft tissue, but you go to the bone and then go the other way. So that.
But we're still cutting bones. So you still cut bones, still takes 6 weeks to heal.
No, so I see minimally invasive approach, much less postoperative edema and postoperative pain. Well, at least in my experience so far. So I cannot generalize.
According to my colleague, Nicholas Cullen, Mr. Nicholas Cullen, who's a foot and ankle specialist in Stanmore and the leading orthopedic surgery place in just outside London, and Nick's runs the foot and ankle course. He says that, his points on minimum invasive surgery, there's quite a steep learning curve between open and minimal.
Yes, it is true because you're not seeing it.
During that time, there's a lot more higher complication rates. And he says, do these complication rates remain higher?
No, I don't agree with that. You just have to get the structured learning. If you start performing minimally invasive surgery on live patients without proper training, yes, that. But to me, same goes for traditional open. If you don't get trained in residency training and you don't know how to dissect the skin, you don't know how to identify the tissue structures and muscles and tendons to get to the bone, you're going to have a high complication too. So we cannot generalize.
Just let me put in context. Nick's one of the leading orthopedic foot and ankle surgeons in the UK. So this is just his point of view. He also says that expectations of patients can be a lot higher over open surgery because they read all the things about minimal surgery, and then their expectations can be higher for minimal surgery, and sometimes that doesn't happen.
I don't know.
And he also says again, whether you cut a bone minimally or open surgery, it still takes 6 weeks to heal.
Bone takes 6 weeks to heal. However, the approach of post-operative, the post-operative procedure or the phase that patients go through is different from traditional open. We're not fixating internally. We want to promote secondary bone healing rather than primary bone healing by fixating it. Follow the Wolff's law, physics. Mm-hmm. So the approach is different, and So, we're the surgeons. We're the one who cuts bone and fix it. And then, after that, though, it's a patient that who's going to go through the post-operative, the procedures. Yeah. To me, minimally invasive surgery, it makes their post-operative phase much easier because they can walk on it. Well, as long as they walk in a, proper instruction in a surgical boot. But because we want to promote that bone healing, and then, it wants to go to better and ideal position and level, not by fixating it. So it's again, the concept problems, principle problems. I'm not judging anybody. I know it works because I've seen on my own patients and all the doctors that I've been helping. So it's just think of it as this. Hold on, Justin. So let me finish. Think of it as this. Minimally invasive surgery is just another great alternative foot and ankle procedures we can provide patients.
Because many people have you trained now, Dr. TJ, in the minimal invasive. I mean, it must be in the hundreds, if not coming up in thousands. How many would you say over the last number of years?
Oh, I've hosted and organized international MIS cadaver lab conference past 3 years. All of them sold out. That's close to 200 doctors. I did that, every year, and then my private clients, I trained over 60 doctors now in our private course and private cadaver labs, but. Again, I'm not teaching them anything that I invented. I want to make it clear. I've been teaching them. No, I didn't invent any procedure. I've been teaching them and showing them, relaying the procedures that have been published and have been working. I've been basically spreading what I learned from my master, and then I'm trying to replicate as much as possible in my ability. And I still have my mentors as a counsel. So if I cannot handle certain things, I talk to my counsel, my mentors. So there's nothing that I invented, but I want to provide alternative option.
Just like me, I've always stood on the shoulders of giants. Just want to say a shout out to my uncle Jeff Blake. Hi, Jeff. How's it going? We'll get together soon. And Doc Dockery's on. Doc. Yeah, so Jeff Blake, hopefully, Jeff, when are we going sea trout fishing? It's great down here in Carlingford. Give me a shout. Yes, and so you also think there's less swelling after the minimal invasive surgery?
What is it again, Justin?
Is there less post-op swelling?
Yeah, less post-op swelling in my hands. And then, patients, the satisfaction rate, the clinical results and patient satisfaction rate, so far to me, it's much higher. So for me, it's, I can do either way. I can go traditional open. I've been practicing 11 years of traditional and 7 years of minimally invasive surgery. So I can go either way. If I need to remove big cyst or something, I still have to open it up.
Still got to go open. Yeah. So for certain procedures, you're obviously going to go open. But as you say, they're back. They're weight bearing again a lot quicker. They're back into footwear probably a lot sooner.
In general, because we're not God, so we make mistakes, or some patients don't respond properly. Well,
I've met, I think they are.
No, we are humans. Don't expect us to make perfect surgery every time. So I make that super clear with my patient during pre-op consent phase. Patient needs to be definitely consented, really clearly informed every possible complications that could happen. So, patients have a clear picture of what they're going to go through. So, my suggestion, my advice, don't give them the best scenario, give them the worst scenario that could happen. So patients, clearly understand what they're going through. If they don't want it, they can always cancel it, because most of them that I do is elective.
Yeah. But what is it? Under promise, over deliver. That's what it's all about.
Yep.
Yeah. And then hypocure. Anybody who doesn't know what hypocure is? A lot of the students who used to come to me on placement in my practices when we saw the final year students had never heard of a hypocure. If anybody doesn't know, it's an implant which goes into the sinus tarsi, different sizes, and it stops foot pronation. Yes. Have you done one of those procedures, Dr. T?
Yeah.
Jay? Yeah. Do you like it?
I like it. It works great in a right candidate. So you just have to go through the very careful patient selections. Actually, I'm a good friend with the founder of Gramedica and Hypercure. So
Richard.
What is it?
His name's Richard, isn't it?
No, his name is Michael Graham.
Michael Graham, that's it. Michael Graham, yeah. We need to get a chat with Mike. I've only ever seen one person in Ireland here who had it. They had it done in the UK. A couple of colleagues in the UK, they're not quite keen on it.
I believe
the wrong patient selection for them.
That's the most important thing. That's the most important thing. I've done more than a couple of hundred. That's a very important point, that if you have to go to extensive preoperative, the exam, diagnostic exam, X-rays, biomechanical. You have to consider a lot of factors, and pre-existing medical conditions, bone structure. So if you go through, and if patients are great candidate, this is a great procedure to fixate. To fix the rear foot instability that cause a lot of issues in the forefoot.
Mm-hmm. Yeah, and there's a really good video on YouTube with the hypocure, where it shows the live fluoroscopy imaging of the foot, and you can see the whole. We're taught it's a rigid lever, a functional thing. Watch it when it moves under fluoroscopy. You see the metatarsals all deviating, the mid-tarsal joint collapsing. There's so much flexibility and movement in the foot. It's amazing. But I do know one colleague in the UK. She went and had hers one foot done in the States a few years ago. Was really looking forward to it and was blogging all about it. Afterwards, I don't think she's had her second one done yet. Maybe she changed her mind. I don't know whether she actually got the results that she wanted, but I must follow that up. A colleague called Emma Supple in the UK said she seemed to be a big advocate for it before she had it done. I don't believe she's had her second one done. I could be wrong, but again, it maybe wasn't the procedure for her. I think she was about 40 old when she had it done. Do you find it works better in a slightly younger patient group?
Yeah, children, teenager, really their bone space is bigger. But again, adults, it works if you find the right candidate. Because adults, if you really think about it, because I've done all different ages, with the HyperCure. So adults, you cannot also neglect the factor of psychological factor, because they've been living with the flexible flat feet for so many years. Suddenly their whole foot structure changed because of the implant or stent. We call it stent. Well, then, psychologically, some people, certain selection of patients, they cannot accept that fact. So some patients, I had to remove them because psychologically they're not happy, but less likely with children and teenager. I've never removed from children or teenager. So, the patients that I have removed stent, they're all adults.
Yeah. My colleague Simon Crutchley says, I value surgeons, but a simple clinician, it really does my head. He says, as a simple clinician, it really does my head in when I try to tackle a disgruntled patient who now wants to try conservative care after a failed surgical procedure. We have a lot of those.
Well, that's very true. That's very true. That I like, I'm happy to see someone wrote that comment, because I don't jump onto surgery right away. My patients, when someone comes to me as a surgery consultation, their minimum waiting is 6 weeks to 8 weeks anyways. I don't jump onto any surgery before I try conservative treatment. Unless the only exception is we already know that patients tried most known conservative treatment by different doctors, and then they came to me as almost second or third opinion. Then if it's probable that they really tried conservative and then the other only options kind of left over with the surgery and they want to fix it, sometimes I bypass. But except those, I like the idea to go through a conservative, no doubt. I love to go with a conservative treatment first. Yep.
Because we would regularly see patients in our practices and clinics that I had in Dublin who were waiting on a waiting list for either the health service in the UK or in Ireland here, waiting for the orthopedic, the to see their family physician, a general practitioner here. General practitioner said you need to see an orthopedic surgeon. These patients come in to see us. They've been on the list maybe 6 weeks, 6 months. My first question is, do you want surgery? A lot of them go, no. And it's like, well, then why are you seeing an orthopedic surgeon? Because you're going for an orthopedic opinion. If you don't want surgery, you're wasting your time. Oh, but the guy said, the doctor said, so you get these clinics full of people who don't want surgery, waiting for 6 months, a year, blocking up the whole system. And they don't really want surgery. And I've seen some bad procedures. I mean, a lot less more recently, especially one. It was a really bad one in back in the mid-90s in London, where this lady had a bunion surgery, a Keller's procedure done. Jesus. Her second and third metatarsus, she had stress fractures in them 6 months after. The guy had completely screwed her foot. I think he was a shoulder specialist. What he was doing down the other end, I have no idea. But again, more training and obviously residencies. A lot of podiatry colleagues, a lot of orthopedic colleagues go to really good. The States, go to Australia, come to Ireland. I mean, of course, Northern Ireland is one of the Musgrave Park Hospital. Northern Ireland is one of the leading orthopedic centres in the world, especially for trauma. If you know the history of Northern Ireland, in the 1970s and 80s, those guys know how to do trauma surgery. So leading orthopedic surgeons all over. But yeah, certainly, of course, there's more specialized training in all aspects of all aspects now, rather than just a general, catch-all. But I certainly wouldn't want a shoulder or an elbow guy going anywhere near my knee or my hip or my foot. I certainly wouldn't want that for any of my patients. But yeah, I think, so a lot of people are very, quick to jump to surgical rather than, as you say, starting off with the conservative care. Of course, some people want a quick fix rather than having to do rehab and having to do footwear changes and having to do orthotics or, a whole thing. They just want it done. Do you find that?
Oh, yeah. Yeah. Some people, like I said, some people likes to go quick fix.
Yeah.
Sometimes I mean, we cannot generalize, right? So sometimes there's always case by case. Some patient situation, I mean, it's so clear that sometimes surgery is the fastest way. I cannot say everything is, applies to everything. So you have to be flexible. I really believe you have to be flexible enough. You cannot be so rigid, and because you have to have an open mind. Always ready to learn new things. Accept your shortcomings. Accept your weakness. So that's why we continuously invest in ourselves, in education, new knowledge. Continue to improve your hands-on skills. I see some
charge the higher fees to be able to do that.
Right. I see someone here write a comment about surgeons indulging their egos. If you don't mind, talk about that, Simon. Sometimes you can perceive that as an ego, but I want to also open that discussion. It's just how you look at it. It's just how you look at it. We cannot. This is just my opinion, Simon. We cannot judge, anyone's because that's coming from you anyway. That's how you perceive that. Okay, he must or she must be indulging their egos. But let's face it. Be a surgeon. If you're a surgeon or doctor, you have a license to help other people on their health, or you fix their problem. You have to have a certain confidence to be able to do it. Sometimes overconfidence or competence may protrude as an ego, but without strong confidence that could be viewed as an ego, that's not a good doctor. Doctors should have strong belief in what he can do or she can provide for their patients. That's what I always say about, in my podcast or in my, Facebook group or my clients. Hey, doctors, you became doctor to help someone and you chose your specialty. Then you have to defend your position. You have to take the stand. Don't, if you believe in what you do is true, take the stand, and that can be viewed as an ego. But sometimes you're right, Simon. Some doctors do have an ego, I think, right? It may be a little bit more showing than others, but we all have that pride, confidence, and we believe we can help people and we want to help people. So sometimes that could be viewed as an ego. That's my point. But, not everybody's like that, Yeah.
I mean, I started off after I qualified. I did start my postgraduate surgical training. I did my first couple of exams. Then I just decided to focus on the musculoskeletal side of things. I met a couple of surgeons, but they are, and of course, I mean, all the minimal invasive procedures with you, it's all done under regional block, local anesthetic block, rather than general.
Yeah. With in America, typically local and IV sedation if they need twilight sedation. Yeah, but if we do extensive rear foot reconstruction, things like that, sometimes the general. But now I do most procedures in my office procedure. Yeah. So mostly my cases done local block, and sometimes I bring anesthesia to my practice and they provide IV sedation.
Yeah, because I've seen your online your clinical setup, and again, you help the surgeons that you train. You help them to set up their in-house surgery clinics as well. You give advice to them that as well, don't you?
Huge economic benefits for doctors, and both doctors and patients. If you can do it properly, patients save so much money not having to go through the hospital system or big surgery center.
Yes. Yeah. And of course, I mean, so then, I mean, does the insurance cover? Because of course, a lot of surgeons, when I work with guys, and I look with guys, and again, let's just let this settle for a second. I'm in talks with guys in Texas, and again, my friend Wayne Edwards in London. I mean, they've been coming out of network, out of insurance. Wayne has transformed, and I've helped him. They were about 60% of insurance patients. Now I think we're down to 20%. So of course, there's quite a rush out of coming out of network, isn't there?
Yeah. In America right now, it's kind of transition, almost like close to socialistic medicine, that the reimbursements keep going down and doctors' responsibilities keep going up. And not even that, patients' responsibility, patients' payment portion is getting more expensive every year. So
crazy.
Yeah. Basically, insurance
I was talking to one guy. Who used to live in Dublin. He's relocated to San Francisco. And I think he was saying he was paying about $2,000 a month of insurance alone. And we had to have an X-ray. They wanted about another $2,000 from him in fees. It's like, what? What is the insurance covering? I mean, he was talking about his insurance is nearly $30,000 a year. Is that right?
Yeah, that's the reality in America right now.
Oh my God. And I mean, he had to pay for everything. He had an X-ray, it was $2,000. He had something else done, it was another $1,500. This is out of pocket. The insurance didn't even cover this.
Because we have a system called deductible. So deductible, that's the first part. Patients are responsible before insurance benefit kicks in. And that deductible used to be like $200 or $500, which makes sense. But now it's not uncommon to see $5,000 deductible. Every patient's typical good insurance plan has $5,000 deductible, means first $5,000 patients have to pay with the insurance.
Okay. I certainly won't be moving to the States anytime soon. I'll come and visit though, because I've been talking with a group in Texas, and if anybody wants to find out or some help to find out about how they can transition or pivot away from the insurance-based practices to more a cash pay practice, let me know. I can help you with that. Because it's just a crazy situation. Again, my colleague Wayne in London will tell you that one of the insurance companies, you have to now submit your plan for the patients. And the insurance company just goes, no, we're not going to pay for that. We're not going to pay for this. We're not going to pay for this. It's like, what? The insurance companies are dictating who gets the treatment, not the clinician, which seems to be absolutely crazy. That can't be right, can it?
Yep.
Dr. T, okay, we're frozen again. Sorry, I mean, that can't be right. The insurance company decides the treatment plan rather than the clinician.
Yeah, I don't accept that. So I take action.
No.
Yeah. So that's why, I don't know if you're aware, I wrote a book, Where is it? So one thing I can offer for you, one thing I can offer for your audience, I can send my book. The book title is called Opt Out. So title of my book is Opt Out. So I want you to opt out of.
When did you publish this?
Last year. And again, if you guys, you can put my contact info. If they come back to me, it's basically optoutbook.com, optoutbook.com. So,
it sets up, you go through a logical, because you just can't phone up the company or just send them a letter and say we're done. I mean, obviously there's transition period that you have to work through.
Yeah, no, I'm not. Sure. Yeah, this one is more blueprint, more playbook. So if you go there, you just cover the shipping. I'll send it to you. You don't have to pay for the book, cover the shipping. So, I'll send the book.
Yeah. Normally we leave this to the end, but I think we have got a little bit more to talk about. But how can people get in contact with you The book is at optout.com, but how else can they get in contact with you, Dr. TJ?
drtjon.com. That's my website.
Yeah.
You can find me in the Facebook, and text message or direct message me. I have a lot of good webinar recordings you can listen to. So I have a lot of free resources. You can start.
You've got your new podcast as well.
Yeah, the podcast is called Podiatry Profits Podcast. Podiatry Profits Podcast. Mm-hmm.
Yeah. How's that been going for you? Good?
Yeah, I just launched 2 weeks ago, and second episode is out. It's all about how I can help you to think differently and start increasing podiatry profits.
Yes. Yeah, I mean, I'm writing a book at the moment. People think I just play tennis and fish and sail, but I actually do some work. So Wayne and my colleague, he's really made a difference in the practices here. Yeah, you have all those extra co-pay payments, and then the insurance company get to dictate the treatment plan. Absolutely ridiculous. And so with the students that are coming through now that you are at the university at the Rosalind Franklin, I mean, is the future quite bright for podiatry in the States, do you think?
Quite frankly, no. They have to learn more business aspect. That's my opinion. That's just my opinion. Because let's think about it.
Yeah.
Let's think about it. We have a limited number of hospitals. We have a limited number of positions for doctors. And actually, in fact, because of healthcare system crisis, they're decreasing the number of doctors in the United States. They're increasing number of nurses and physician assistants, and doctors in their position in the hospital system, they're getting weaker and weaker and weaker every year. So if you don't know how to build that business mindset when you get out of school system and when you finish your residency, if you're just technician and surgeon and physician, you don't know how to run business properly, you're doomed to, much inclined to fail because you don't know, because you don't have an idea how to run numbers, how to run marketing, how to run sales, all the other aspect of business. Unless you learn those, you're in trouble. But on the other hand, can I finish, Justin?
Go ahead.
On the other hand, if you prepare yourself, you are in a gold mine. You're in a gold opportunity. Because majority of physicians in the United States, they're not trained in business. But if you train yourself in business and marketing and you can provide ethical solutions to your patients, you're going to become the authority and you're going to be so successful. But only for those who see this through and prepare yourself and educate yourself in other area of practice, not just the physician skills and surgical skills. That's it, Justin. Yeah.
That's okay. If anybody wants to find out how to do that, they can talk to me because that's what I do now. I help great clinicians build fantastic businesses. But 3 years ago, I had that exact conversation with one of my colleagues in the Galway, Ireland University, and the students were coming out. He said to me, "Well, Justin, not all students want to go into private practice." And I said, "Well, hold on, Nigel. There's 17 people qualifying this year. There's 2 jobs in the health service. What are the other 15 going to do?" He didn't know. Yeah, that's right. 2 jobs are advertised, 17 people. What were the other 15 going to do? No idea about business, hadn't a clue. But again, I didn't have any idea. I ran practices really badly for about 10, 12 years. And then I decided to actually learn how to run a business. as you say, it completely changes the way you look at things. And once you start again, then coming from things from an abundance mindset rather than that scarcity. Anybody out there, we're going to be talking to Sue later on, southwest of England. She needs to double her prices tomorrow. Give them better service. Nobody's shopping. Nobody's looking. Everybody wants better value, as we touched on earlier, especially when they're in their health. And it isn't just in your area, Sue. It's the prices are the same, can be anywhere. Where I lived in Ireland, in quite a rural town, quite close to here in Dundalk, we were charging 3 times the practices around the corner, and they're all scratching their head and wondering how we were busier than they were. I mean, just completely crazy, just a crazy mindset. In Dublin, we were maybe double what a normal practice was. And again, never been busier, just like yourself, Dr. TJ. And people don't want to skimp on their health, especially not now. Busy mindset, but. The podcast. I've still yet to record. I've got all these interviews I've done. I've got about 16 or 18 weeks of podcasts to come out now, but I've been too busy to record the first introductory. I've got to do that this week and get things cracking. And so you think the future? Yeah. Well, of course, but I think is there much training in the universities then, or is that more postgraduate, or again, do people just? Are they just signed off at the end of their qualification and then they have to work that out for themselves?
Yeah, I think they do have some practice management side, but I really believe that side should be more amplified, and balance education, not just the clinical skills, but they need to learn business skills.
I offered my services for free to go to the university in Galway to talk and help them to mentor them about business. They weren't interested. So anyway, can't do anything about that. But not that I'm mocking. It's a very good school, very, very diabetic focused. The only one in the south of Ireland, and produce really good students. So to say, we used to take the students in their final year placements. And we used to take 3 or 4 students at a time over 3 or 4 weeks. So we used to see about half of or more of the year was throughput. Some of the students worked out. Yeah, it was a 2-week-long interview. I employed a lot of students from Galway. Some of them didn't realise that it was a 2-week-long interview, the placement, but there you go. But yeah, some very bright students and some guys who came on to work for me have gone on to continue work and put out and open really good, profitable, I hope, practices. And maybe they took some of my business ideas and implemented them in their own practices. Because if they didn't, I would be quite worried. So are you got quite a full day later on today? You operating later?
Yeah, no, because again, concierge practice makes my podiatry practice life so much easier. So I work 3 days a week as a podiatry practice. So right now, today, Tuesday, I do my consulting side, but I do have 6 meetings today. So I have a pretty busy schedule. Mm-hmm.
Yeah, I mean, I've got another call. I better not run late. I've got another call now at 5 and another one at 6:30. So it's a pretty busy day. And then I'm going to be on again, live again tomorrow morning, 7 a.m., our usual Wednesday morning live business talk with my colleague, David James, Kate Markland, and Celia Champion. And that's where we've talked about a lot of these things over. So that's a regular 7 a.m. slot. So yeah, Wednesday's usually quite a busy day. This Tuesday's going to be quite busy too. Although the sun, it's brightening up now. Might get a little bit of tennis in later. We'll see. So what do you do? Well, you're quite into your martial arts. I mean, you lived in Japan for a couple of years. You focused on your Aikido, yeah?
Yeah, Aikido and Brazilian Jiu-Jitsu.
Well, I actually went to there's a local Jiu-Jitsu dojo here, Brazilian Jiu-Jitsu. I went, the young guy who was there yesterday wasn't too sure about how my hip would last in it. So he did say one of the guys last year had his hip replaced. and he was doing quite well now. I hadn't held him back, but I think he was a practitioner of jiu-jitsu before he had it. Any advice for me? You think it would be good if I'd have had a total hip replacement? Because I can walk mountains, I can play tennis 2-3 hours a day, I can fish and I can sail and do everything, and it's absolutely perfect. So full range of movement back now, probably even better than my left one. So the jiu-jitsu shouldn't be an issue for me, should it?
No, jiu-jitsu, my jiu-jitsu, Brazilian jiu-jitsu works on the ground, and you use a lot of hip. You use a lot of hip joints.
Usually hip and pelvis use a lot. Yeah, I mean, this guy's a Gracie practitioner.
That's what I did. Yeah.
So I called in. Yes, I called in yesterday, but the classes didn't suit. So I think I maybe might get there on Thursday morning, or I think they have a beginners no gi class on Friday midday. So I'm going to go into that. We'll see what it's like. Seen it.
I think you're going to have fun. Have fun.
Yeah. I should have fun. How long have you been?
Huh?
No, I'll try not to. Well, I'll just tap out. And did you started the Aikido first before the Jiu-Jitsu, or did you do them side by side?
No, Aikido first. So back in 1992, I did until when I came to Chicago, 2008. So about 15, 18 years of Aikido. And then my Aikido master, he passed away. So I got sad, and then, I felt like I lost my mentor. And then by that time, I found Brazilian Jiu-Jitsu by Carson Gracie in Chicago.
Yeah.
So
that's right. Yeah.
Carson Gracie Sr. came to Chicago from Rio de Janeiro, and I met his son, and we became close very fast. And then, from that point, I did Jiu-Jitsu for many years. Mm-hmm.
Because I think his name, the son's name is?
Son's name is Carson Gracie Jr.
Junior. Okay, yeah, because I think he's very into this yoga now as well, isn't he?
Well, he travels all over the world, so he's same age as me. So very humble, very very strong, but very humble.
His back not. I heard he had a lot of disc or vertebra problems and stuff. And
I don't know. They have like 5-6 Gracie brothers, so I don't know whom you're referring to.
Okay, and it's just I saw an interview with Joe Rogan, and he was talking about it because he's a practitioner. I think it was when he was talking with Guy Ritchie. They were talking about because he's a practitioner as well. And they were talking about, but Joe Rogan's quite into his yoga, for the flexibility and things. And
I think yoga is very good. Yeah, very important.
Yeah, all about the breathing. I think that's quite important in the jiu-jitsu as well, isn't it? The breathing.
Yeah, any martial arts, any sports, I believe breathing. Even meditation, as you know, everything based on how we inhale and exhale.
Mm-hmm. Yeah. Yeah, well, of course, the meditation has helped me quite a lot over lockdown. We need to still the mind a little bit more.
Yeah,
in these say quite challenging times, as we'll say, and so I'll see how I get on Thursday and Friday. There was a class night tonight about 7:15, but I was just too busy to put a few things on. So I think it's Thursday or Friday. I'll need to check. I'll let you know how I get on. It should be interesting, because I was aware of it over this. I know quite a few people. Nancy, my ex-wife, she's going for Taekwondo black belt grading in a couple of weeks. It was postponed just before, so she's been a practitioner over Taekwondo in the last 5 or 6 years. So they were supposed to have their black belt grading in the end of March or April. But that's been postponed now, but I think it's a week or two. So, to know when to get my ass kicked, I'll have to start practicing something. And,
you know what? Justin, for me, martial arts is, it got a lot of different disciplines, But I really believe, we're not just doing martial arts to defend ourselves, but martial arts it helped me navigate through obstacles of life, and how to forgive people, and how to really, it helped me tremendously. Without martial arts, I don't know where I would be, so it did influence my whole life, how I communicate with people, how I handle things, roadblocks. So I think martial arts is beneficial in that sense, especially profession we have, that we can have easily a lot of stress. But learn how to go direct, or sometimes how to back out, or how to turn around. Those martial arts principles I apply to everyday life.
Yeah, because you just can't go direct all the time. There has to be a bit of and I mean, like you. That's one of the things now that I'm now retired. Not really from actual clinical practice, is that I certainly do not miss the treadmill of 20-minute, half an hour regular appointments, 18, 20 patients a day. That can be quite tiring and draining. I was burned out. I think you had that same issue some time back. You were going to quit podiatry, weren't you?
Yeah.
Yeah. And what changed your mind? Was it just did you refocus, or did you pivot slightly, or?
During the COVID?
No. Sorry. When you had a period before where you thought about stopping podiatry or a career change.
Oh, again, I was applying my martial arts principle. I'm like, well, if the whole system's going that way, why would I fight? Sometimes I think Bruce Lee said that if you realize your opponent is much stronger than you and faster than you, the best strategy is run away. Why are you gonna head to head and then die? So my goal was. Is
it Sun Tzu or pronouncing that? The Art of War.
Right. Art of War, right?
You have to fight. You already lost.
Yeah. So if you know that going into fight that you're not gonna win, why would you go into fight? But anyway, that was a pivotal moment, and I was gonna go venture into different business. Then, really, for me, minimally invasive surgery, that was the key pivotal moment that I can see that become my niche, and I can become really successful and continue to help people. And that minimally invasive surgery, to me, that was my epiphany moment. So I went back.
I've had a number of different niches, or a number of different careers within podiatry, from dance medicine through to ski alignment, through to bike fitting, the foot mobilization therapies, all the rehabilitation. So I've had a number of careers within podiatry, and certainly we do think you do have to niche in. You do have to certainly focus in. But I'm probably like you. I get a little bit bored after a while once you've mastered, or have your head around the way to do it. So within 30 years in podiatry, I've had a number of different careers within that, and that's what I talked to Cassidy, who's just starting in her journey in podiatry. You will have a number of careers within the actual journey of podiatry, and that's the great thing about the profession, I think, compared to a lot of other clinical practice. Is not that I'm stating a pharmacist, but I think it'll be quite boring counting pills every day.
Yeah, you know what? Though, in any field, in my philosophy, I never consider myself as a master. That mastery is the word we need to be very careful. I believe, I'm proficient. I'm proficient in minimally invasive surgery. I'm proficient in business, but I will never call myself a master of minimally invasive surgery, because master of minimally invasive surgery, I reserve that to my mentors.
Okay. And so you don't go for the Malcolm Gladwell sort of 10,000 hours philosophy then?
I go for it. I always strive to become better version of myself every day. However, I don't think I'm going to reach the mastery level, because I've met masters of martial arts. I've met masters of minimally invasive surgery. For me, common trait that I found from that I truly believe masters of any field, they seem to contribute their mastery in that field more than their personal life or their family. They have the sacrificing factor. To me, they sacrifice their other life for whatever they believe in. I'm not that. Mm-hmm. I don't think I'm going to sacrifice my family or my personal life over my profession. So that's the main key reason why I'm not going to call myself a master of anything, No.
Yeah, you got to, well, as you say, and I was able to do that when I learned how to run a business, was like you. I was able to structure my business so it worked for me rather than I worked for it. Days off, never missed, plenty of holidays, time with the family. Before, when I run businesses badly, I didn't have any of that. I was a busy fool, making no money and working 80, 90 hours a week. Right. When I actually figured out how to do it, changed my life. The only reason the business is it has to work for you. You don't work for it. Again, right. Anybody wants to know how to do that or is struggling with that, let us know. It's all. If I can do it, anybody can do it.
Yeah, I learned from masters. Mm-hmm. No, I said I learned from masters to be efficient and to be successful in my professional career. But I want to balance myself with my family, because I love my family. I love my friends. I love my other part of our lives. We live once. I want to have a balanced life, And
that's it. Again, as I said before, I've always stood on the shoulders of giants. That's the easy way to do it. And I think one of my mentors said, we talked about this a couple of weeks ago, smart people, successful people, they spend money to save time, because time is the only thing we can't get any more of. Right.
Totally agree. Agree.
Yeah, you got to spend money. Very simple tip for anybody who's doing their own bookkeeping or any accounts. Get a bookkeeper in. Change your life. I used to meet with mine every second Thursday for 10 minutes, write a couple of checks. She told me where we were. That was it. Everybody's always like, we're too busy. We've got piles and piles of paperwork and tax returns and what do you call it? Your madness. You pay somebody to do all that for you. Farm it out. Google AdWords, do your marketing for you, do everything else, so you can have a life. Successful people spend money to save time, or to give them more time to have their family time. Okay, Dr. TJ, we're going to go. It's been great. And again, anybody can contact you, drtjan.com, and your book was called again?
Optoutbook.com. Optoutbook.com.
Anybody wants to, and I need to mention, are you aware there's a Forgotten Feet charity in the UK? I need to mention this. It's forgottenfeet.org, and it's podiatrists providing services to homeless people and disadvantaged people. And next year in May, they're cycling the length of the UK. They're cycling from the south of England right up to the north of Scotland, Land's End to John O'Groats, at 900 miles in 9 days. I'm going to sail it. I do a bit of sailing. We're going to sail from Land's End to John O'Groats, up the Irish Sea, around the north of Scotland. It'll only take us about 4 or 5 days in a fair wind. We're looking for sponsorship. We're also looking for international podiatrists to come across. We've got some interest from New Zealand, some interest from South Africa. People want to cycle, some people want to sail. If anybody wants to help, forgottenfeet.org, or they can contact me. I can let you know more details. We're in talks with a couple of companies. Maybe we're going to get the thing sponsored, the cycling, the sailing. I'm getting the sailing sponsored. We're going to get about 18 people on a 70-foot racing yacht. Go for a bit of a spin up the Irish Sea. Should be fantastic. 9th of May next year, all being well. So that's forgottenfeet.org. And again, anybody wants to contact me is justinblakemedia.com, or again, Justin Blake Podiatrist, or Ask JB. So that's it. I'm back on 7 o'clock tomorrow morning across all the usual channels. Dr. T, it's been a pleasure. DJ,
Thank you. Yeah, it's been a pleasure. Thanks for chatting with me.